Hey, good people. This chapter in Introduction to Social Work, we are going to be talking about roles and functions of the generalist social worker. Now, I want you to be mindful that when we're talking about roles of the generalist social worker, there are going to be several different roles that will be brought out in the reading of this chapter, and some of them that I will be referring to during this lecture, but I won't be referencing them all. However, I say this because I just want you to be mindful that although you may see several different roles being mentioned, several different types of positions that social workers can function in, the overall message that I want you all to receive is that under a generalist social worker and under the foundation that you're creating and the curriculum that you are going through, you will be able to function in any of the various roles that are discussed in this chapter. So just be mindful of that. I don't want you to get lost in the terminology, but just know that you're going to be equipped, with the skills and the necessary resources to be successful as a generalist social worker. So let's get going with this chapter's lecture. So when we first start talking about the generalist approach and looking at our functions and our roles in social work, we have to have an understanding about the characteristics of what a social worker does and what the outcome we intend for it to be. And so when we're talking about our function as a social worker, our function is basically to look at what our clients, consumers, or patients may be experiencing, but looking at it through a very broad perspective. If you've taken Introduction to Sociology, then you would know that that broad perspective would kind of be referred to as a structural functional perspective. So when we're looking at this broad perspective of what our clients, consumers, or patients may be experiencing, in the field of social work, we have to have an understanding that sometimes what they may experience begins to overlap one with another. And sometimes things begin to impact, one issue may impact another issue, which could begin or fall into a whole nother issue or whole nother area of social work practice. So we just got to kind of be mindful of those things. And in the chapter that we're going to be reviewing this week, the three issues or overlapping issues that we'll be looking at are going to be consultancy, resource management, and education. And we're going to break all three of these functions down, looking at it from the micro, meso, and the macro perspective. So again, as we're talking about functions and we're talking about roles, when we're talking about the role of the social worker and the role of our client, consumer, or patient, we are looking at and defining behaviors. That's what your role is. Your role is the expected behavior. So when we think about the role that a social worker performs, the role that a client, consumer, or patient may function in, we have to ask ourselves, what is this behavior that I'm seeing or that we're assessing, and how is it matching with, how is it acknowledging, how is it being fed by the environment, the resources, or the lack thereof for this patient, client, consumer? So again, when we're talking about the roles, we're looking at the expected behaviors, the prescribed behaviors, the definition of behaviors, but we're also wanting to make sure that we understand the role of the social worker. And when we talk about the role of the social worker, we have to know that from a social work perspective, you see here on your slide, there's three different theories that we look at. We look at the role concept, role expectation, and role performance. When we, in talking about all of these three different strategies of the role, all in all, it buckles down to or boils down to the expected behavior, what people believe the certain behavior ought to be or the actions ought to be, what people believe the action of another person ought to be, and then overall what people are really doing as it pertains to their environment that they may be working in or that they may be living in. So the overarching goal of the social worker, as we define the role of, or I should say the behavior of the person, the expected behavior based on someone else's perspective, and the behavior based on the environment that they may be functioning in, we as the social workers have to have an understanding that our overarching goal is to be able to empower our client, consumer, and patient so that they no longer are reacting to a situation or reacting because of an issue or chaos that may come their way, but that we empower them so that they know how to respond, that they respond appropriately with the appropriate tools and the resources that we present before them. So the very first strategy that we're going to talk about today is consultancy. Again, we have three of them that we're going to be looking at. Excuse me, it's consultancy, resource management, and education. So the first one is consultancy. And you see here on your screen that the overall general description or the general idea of consultancy is that we want to be able to identify a client's strengths, their competency, or their areas of competency, I should say, and also let's not forget their weaknesses, because it's our goal to look at, when we're talking about consultancy, as a social worker, you want to look at how am I going to find clarification? How do I find understanding? How do I find potential options for this client, consumer, or patient to function in according to the issue that they may be bringing before you? When we talk about consultancy from a social worker's perspective, and we're looking at it from a micro level. Now, the micro level is when we're talking about working with this client, consumer, patient, the person. Okay, so as a person, when you're working with them, you're going to be working with them as a counselor. You may be working with them as a therapist. You may be working with them as a peer supporter or a peer mentor. The whole idea in consultancy, when you're functioning at this micro level perspective, is you're focusing on the individual that comes to you, the client themselves. And let me clarify that. So the client can be an individual, a family, a group, but your focus is on that person or that client themselves. And you're looking at what their strengths are, what their weaknesses are, what are the challenges that are facing them, again, as they're working through some of the issues that brought them to your front door. That's the micro perspective. Now, the meso perspective, or that meso level, is when we're looking at, excuse me, looking at our client, consumer, patient, and we're building off of what is available to them kind of within their support system, the groups, the organizations that they may function with or that they may have as a support system. Now, that meso level, there are many challenges and changes that come with that. So we have to have an understanding about, again, with the meso level, how does this group function that this client, consumer, or patient may be utilizing? What are some of the policies and procedures that this group functions by? And is that an issue? Does it present a challenge for our client, consumer, or patient? Finally, we have to look at, when we're talking about the meso level, we want to look at how is the client functioning, or how are they progressing, how are they benefiting from the services that are here? And when we talk about and ask that question, how are they benefiting, we have to look at how the client may be evaluating the services that they're receiving. So again, that's that meso level, talking about the formal and informal organizations that a client, consumer, or patient may be working with. When we get to the macro level, now the macro level, again, we're looking at what the role should be as you, the social worker. So when we're talking about that macro level, we're looking at some definite community change. Again, coming from consultancy, you are coming in as an expert. You are coming in as an expert, and you're looking at how is this community, how is this this society, whatever issue you may be dealing with, how are they addressing this issue? How are they looking at resolution of the issue? When we talk about working at the macro level as a consultancy, you may come in there as a community mobilizer, as a planner. You may be coming in there looking at, okay, well, this may be the issue that we're addressing. Let's say if we talk about here in the greater Johnstown area, we could be looking at homelessness. Excuse me, homelessness is an issue that we could look at because we don't necessarily have emergency shelter for folks who may be homeless. We do have a homeless center that people can utilize. However, there are a lot of strict policies and procedures for this particular facility. So we here in the Johnstown area don't have, per se, an emergency homeless shelter. So we have to ask ourselves, well, first of all, is there a big need in this area for an emergency homeless shelter? That's where we have our community needs assessment that we rely on. Excuse me, I apologize, y'all. The community needs assessment is something that is done um, on an annual basis. I'm sorry, semi-annual basis, and it is usually done in conjunction with our local hospital and the United Way. And they're doing the needs assessment throughout Cambria County and Somerset County. And part of the goal of that needs assessment is to look at what is the community saying the needs are, what are the services, how are the services defining the needs, and are we able to meet the needs right now with the currently existing services, or do we need to step things up a little bit? In this role from the macro level as a consultant, your job is that you're going to be doing a lot of research. You're going to be looking at the environment that your clients, consumers, or patients, the environment that they're living in, that they're working in, that they're trying to develop some type of change in. And your primary goal may be to look at either structural changes or societal changes. So that's coming at that macro level. Finally, when we're talking about consultancy, and actually in all three of these levels that we're going to be looking at, we're going to talk about the professional system. The professional system from the social worker's perspective. We know that as a social worker, we have a governing body, and it is the National Association of Social Workers, NASW. And that governing body helps to regulate the work that we do, whether it is at a micro, a meso, or a macro level. And it gives us the guidance of what the expectation is so that we can reach a desirable outcome. So when we talk about this professional system, we have to know that it's okay to utilize the resources and the expertise of other professionals in the field, of having consultations with other professionals, of creating and nurturing professional partnerships. Maybe not just entirely of social workers, but it may be of other professionals in the helping community. It could be coming from a medical perspective, could be coming from a clinical perspective, could be coming from a financial perspective, but it's okay to embrace that whole idea of how do we work together to make change happen. And I apologize about my dog barking. The next phase that we're going to get into is resource management. And with resource management, again, we're looking at this whole idea of how are we assessing the resources that are available to our client, consumer, or patient, and those resources, are they enabling them? Are they providing them with the power, with the resources that they need, or I should say the tools that they need to be successful? Or is there a lack of resources? Is there a lack of availability? Is the access to the resources, is that in question as well? So again, we have to look at a lot of things when we're talking about resource management. When we talk about resource management with our client, consumer, or patient, we have to be mindful that resources may be in place for people to utilize. However, people are coming with a different perspective, with a different mindset. And with that being said, we have to, this is where we're going to be swaying kind of a little bit back and forth between being that counselor, that therapist, that peer supporter, and also looking at how do we advocate for our client to utilize the resources that are available. Because here is where we kind of find out, are people ready to function when it's time for the rubber to meet the road? Is there any resiliency? Is there hopefulness within our client? What is their motivation like? And do they feel as though they have the appropriate support to move on? And when we talk about the appropriate support, not just within their circle of trusted people, but talking about that support that comes from that meso level as well. Also the support that comes from that macro level. So there's a lot of things we have to look at when we're talking about resource management. So again, coming from this micro level perspective, your role that you're going to be functioning in is going to be one as a broker or an advocate. When we talk about functioning as a broker, your primary job is to be a resource and referral person. You are going to be in the field, you're going to be working with your client, consumer, patient, and your primary job is to connect them with the appropriate resources. Being mindful that, again, everyone comes with a different mindset. So while you're functioning, your primary job may be to function as a broker. You may need to take a step into how do I become this cheerleader, this counselor on the side? How do I help encourage them to move beyond where they are and utilize the resources that I'm trying to connect them to? If there is a problem with resources, a lack of availability, a lack of accessibility, this is where you become that advocate for your client, consumer, or patient. This is where you begin to use your voice and for your client, because sometimes our clients, consumers, or patients just don't have that understanding of that their voice has power. Sometimes they are still functioning under the mindset of being oppressed or marginalized and feel as though they have to accept what's given to them. So this is where you step up to the plate and you become the advocate for them. Now, you're advocating for them for some changes within a system, changes within services, again, coming from a micro level for the person, but you're also demonstrating to our client, consumer, or patient how to have that voice for themselves. When we talk about working at this micro level perspective, as resource management, one of the key things that we have to be mindful of, since you're functioning as a resource and referral person, is documentation is your friend. Case management is a big thing in resource management at the micro level. Case management simply because you have to document the information that you are providing for your client, consumer, or patient, but also you want to document their progress. You want to document so that you can evaluate at the end of their treatment session or the end of their goal session, how well did they do? What are some areas that we need to change on? So case management is definitely key in this resource management perspective. When we get into the meso level, this is where, again, we begin to see folks starting to work on issues within the agency or organization itself. This is where we got to kind of tiptoe lightly, good people, because some folks don't like to have their toes stepped on. Sometimes we have to take a look at what's going on within our agency or organization that may be hindering the growth or hindering the transition process of our clients, consumers, or patients. And so sometimes there may be a position that you, the worker, have to take that says, hey, we may need to talk about some changes within our own policies and procedures here within the agency, that intra-organizational perspective. What are we doing to help things? What are we doing to create a roadblock or a hindrance for our clients, consumers, or patients? How do we work well, or how are we partnering with other existing agencies or organizations, again, so that we provide the appropriate resources for our clients at the end of the day? Now, the macro level, again, this is the broad perspective. This is where you're functioning. Again, you're looking at being an advocate and an activist. This is where you begin to function as a community mobilizer as well. So you may hear that position thrown around a little bit. As a community mobilizer, your goal is to bring key stakeholders together. You want to bring key people together within the community so that we can talk about what it is we need to talk about. Let's look at this issue of homelessness in Cambria County. Why don't we have a homeless shelter? Is there a need? Maybe our evaluation says that there is a need. Well, then why don't we have one? Where do we find the funding for it? What agency could we identify that would be the host agency, or the agency that's going to organize the homeless shelter? Again, from a macro perspective, this is where you pull folks in and you invite them to have a seat at the dining room table. And when they have a seat at the table, don't just offer them crumbs, but offer them, hey, I need you to participate. So this is going to be a potluck type of meal. Okay. So I need you to bring your resources, bring your ideas so that we can kind of pull it all together and have a good meal in the end. And then hopefully at the end of it all, we get to a place where we find that there is change that is necessary. So yes, we do need a homeless shelter, and we've identified the agency that will host it. We've identified different funding streams. We've identified, again, how we can build one on another so that we make sure that the need that we've identified, and that's emergency homeless shelters, that need is being met. This, again, is where we pull everyone, like I said, pull everyone to the table, our key community leaders, agency and organizations. Also, we cannot forget our legislators. Our legislators are some key folks. They make change happen, and they also have access to funds. So we always want to make sure that when we're talking about resource management from a macro perspective, let's bring our legislators into the table. From a professional perspective, again, our overarching agency or organization is the NASW, and it gives us specific requirements and standards that we're following when we look at how do we implement change, how do we encourage change, how do we present the idea, the innovation of change, and how do we do it in a way that is professional, that maintains, again, great networking, not just with our agency, but throughout the service area, and how we bring them folks to the table so that we can be successful in our outcome. Finally, the last one that we're going to look at, excuse me, is education. When we talk about education, you all, education is a big one. We have to have an understanding, and we have to know how to help people get to the point where they recognize that education is power. Education is what is going to help us to gain control over or an understanding of how I can work within the chaos that's presented before me, work with the systems that are presented before me. How do I develop relationships beyond what I already know? How do I begin to build on my strengths and decrease my weaknesses? All through education. When we talk about education and empowerment, education is something that we use to, again, give people the information that they need to make informed decisions. And when we talk about making informed decisions, this is where we begin to see, again, this whole idea of prevention coming into play. There was a group that I work with and training that I attended probably about a year ago, and it's for Cure Violence. It's called Cure Violence Global. And the whole perspective behind Cure Violence Global is that they look at violence as a disease. And when we talk about looking at violence as a disease, we're talking about not just treating the illness of violence, but we have to dig deep and look at what is causing, what are the symptoms of the disease, and where is it stemming from? What are the causes of it? So, when you go to the doctor's office and you tell them, oh, I have the flu, they're not just going to say, well, here, take some Robitussin and we'll see you next year for your annual exam. They are going to figure out what is the stem, what is the root cause of this cough that you have? What's the root cause of the inflammation, the root cause of the discomfort? And that's what they're going to treat so that we get to this resolution that the coughing will subside if we treat the root cause of it. In the fall and the spring of this past year, I had a very bad cough, and it just seemed like it just would not go away. It just continued on and on and on. No, good people, it was not corona, but it just continued on and on and on, and I couldn't find relief from it. And when I went to the doctors, after all the trials of medication that they had tried me on, it finally got to the place where they recognized we got to treat the lungs, because it seems like you're developing a pneumonia or a bronchitis. So if we treat the lungs and strengthen the lungs back, give them a chance to gain their strength, then we're going to be able to decrease the coughing, which is going to subside all these other symptoms that you're having, leading to you starting to feel better. So education, again, when we talk about education and prevention, that's what we're looking at. How do we treat the root cause of something? So from a micro level perspective, your role as a generalist social worker, when you see this on the screen, a teacher role, your job is to provide information and instruction on a certain issue or a perspective. Not so much that you're teaching like this is what you need to do, but I just want to give you the information. I want to provide for you the information that you need in order to be successful. When we talk about providing information, again, when I look at the group that I work with, Cure Violence, and I look at the role of the outreach worker, the role of that outreach worker is to provide the resources for the participants, educating them on what their opportunities may be, educating them on how do we steer clear of this mindset, educating them on how do we build things up, how do we build resources and tools so that you and your family can be successful. Again, your primary job is to teach. When we talk about teaching, we got to look at, again, the way that we communicate, and we got to look at how we're providing the information. When we are communicating with our clients, consumers, or patients, it is our job to communicate with them, to provide the information, not at a level that they cannot understand and not at a level that is demeaning. But we want to make sure that we are communicating clearly enough, that we are sharing the purposeful information and sharing the meaning of the information for our clients, consumers, and patients to kind of grab a hold of, that they begin to say, okay, now I get it. Now I get it. When we talk about where we teach is totally up to the type of agency or organization that you may be working with. You may provide an opportunity for knowledge or teaching about resources and referrals in your office. You may meet your clients, consumers at a public park. You may meet them in their home. It can be formal instruction and informal instruction. It can be in a conference room. It can be over teleconference. However you try to do this or however you embark on this, the main idea is that we make sure that we communicate with our clients, consumers, and patients right at their level, that they gain understanding, not exceeding their expectations and not belittling. That's that micro level. The meso level, when we talk about education, again, we're looking at the systems that may be in place here or the formal organizations. We're providing opportunities for people to come out and hear about some things and learn about new resources, new referrals, new tools. So we may do this in an educational workshop, in work groups. This past year, I provided an opportunity in working with Cambria County Drug Coalition. We partnered together and we brought a seminar together for our faith-based community on looking at substance abuse treatment and the role that the faith-based community plays in the treatment process. It was such an awesome workshop. We had several different panelists there. We had several different opportunities for, again, to embark on questions and answers. And most importantly, just feeding the information to this faith-based community on the role that they play in recovery. Because there is a role that each system plays in recovery. The question is, are they familiar with the role that they play? And that's where you, your generalist social worker, comes into place, where you provide them with that education. Excuse me. So it just begins with knowing what your subject matter is and the audience that you want to attract. Finally, the last one is the macro level perspective. As a macro level perspective, your primary role in one of your functions may be as an outreach worker. And when we talk about an outreach worker, this is where you're going to see a combination of an advocate, an activist, someone that is going to be working in or working towards social justice and looking at equity for your clients, consumers, and patients. So when we talk about looking at it from the macro level perspective, we are educating the community as a whole. We are getting informational brochures out there. We may be having or sponsoring television events or infomercials. We may be having different types of pop-up informational sessions, like in a public area. We may have things appearing on our social media website. We are promoting, we are pushing, we are advocating for change from a systematic perspective. So you're functioning again as an activist and an advocate. That's with education. Finally, again, with education, we end just as we did with consultancy and program management with our professional perspective. We have to make sure that we stay on top of the latest and the most recent information in regards to whatever issue we are addressing for the perspective of the community as a whole. So therefore, we rely a lot on research-based information, scholarly information. We rely a lot on the resources that are out there in the community and how well they are doing, how our clients, I should say, are doing in accessing resources. What type of changes do we see taking place? What type of hindrances do we still see in place? And how do we make this change happen? And again, all of this combined with, and it comes down to, we have to evaluate and look at what's been going on from the past to present, and where does the battle need to continue? Okay, so this is the gist, good people, of the chapter on function and roles. When we talk about functions and roles, again, we're looking at consultancy, resource management, and education. From our micro level perspective, that's dealing with the individual, or I should say the client themselves, which could be the individual, family, or group. Looking at it from a meso level, which is going to be our organizations that are providing support for our clients, consumers, or patients. And then our macro level, which is going to be society or the community as a whole. the system as a whole, changes that may need to take place within that system. All right, good people. So that's our chapter review for this week. I will have a discussion post available for you to complete along with your chapter quiz and chapter assignment. If you have any questions, comments, or concerns, feel free to contact me by my email, or you can call me on my office phone. All right, good people. I bid you love, peace, and bacon grease. You all have a fantabulous day.